2020, the historic year, marking the globe's biggest tragedy ever, the birth and spread of the dreaded coronavirus. 2021 could be another historic year, marking the globe's biggest revival, the birth and spread of the immunization against the virus through the much-awaited vaccine. What's common to both years is the word uncertainty. 2020 dealt with the symptoms and physical contagion of the virus. Well, 2021 to deal with the prevention and cure and better understanding of the long-term impact of the virus. That's what creates the uncertainty. Because uncertainty stems from the lack of conclusive, well-established, and most importantly, credibly disseminated evidence. What does that lead to? Speculation, rumors, and myths, which often actually circularly enhance the uncertainty. 2020 myths were around the efficiency of the virus spread, and 2021, the myths will be around the efficacy of the preventive vaccine launched by several renowned multinational companies across the world. And the questions will always be there and much, much more. After all, we're dealing not just with human health, we're dealing with the human mind, which asks, how safe is the vaccine? Is this the solution to the virus? Is it preventive or curative as well? Will it be successful for all humans, irrespective of their demographic, their health status, their comorbidity? Is it a one-time affair or a two-time affair, post which the receiver is forever declared immune from the dreaded coronavirus? And is it even possible to answer all these questions with certainty at this stage? Of course, that's what we'll discuss through this entire program today, and the process of vaccination, which needs to be made most effective and efficient.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
As always, we have several very interesting speakers. Let's take a look who they are today. Swati.
We have a list of very special guests lined up for today's symposium to discuss myths around vaccination. Let me introduce them one by one. First up, we have a health expert on our panel, Dr. Rajeev Jayadevan, former president, Indian Medical Association, Cochin. Welcome to our symposium, sir. We also have Dr. Amrita Vora, executive principal, GEMS International School, Gurugram. Welcome to our symposium, ma'am. And representing the parents community, we have Mr. Sean Basu, regional head, Grey Education, Bangalore. Welcome to our symposium, sir. A very warm welcome to all our eminent guests.
All right. I think it's important that we get direct voices, on the platform. So what I'm going to do, we have about 10 or 12 minutes left on the show. So I'd require and I'd request both Dr. Amrita and Shaun to ask questions directly from Dr. Rajeev, who can answer them. I'd request both to keep your questions and answers brief so that we can get as many as possible, because these are practical questions coming from the people who matter, principals, parents, and of course, via the parent, the student as well.
Thank you for mentioning the social bubbles. We are in fact implementing those in our schools. I'm sure some doctors like you who have been consulted have suggested, and only then the plans have been made out. So we had some hybrid model teaching learning happening here in India earlier for a bit, very small while, very few children coming in social bubbles, but then again, it's still not safe. And now we are just waiting for this vaccine. And is the vaccine going to be 100% safe? Like, does it really guarantee safety?
The vaccine is guaranteed to be safe. Don't worry about it. There's no safety issue here at all. I'll put a couple of numbers out, because my answers will be very brief here because we don't have a lot of time. If your goal is to get immunity against this virus, we have two options, option A and option B. Option A is to get a vaccine. Let's put 100,000 people through a vaccine. One person goes to hospital, nobody dies. Option B is to get the virus. 100,000 people get the virus, 15,000 people end up in the hospital, and 1,500 people will die. So that answers your question about safety. This is all comers, all vaccines together.
Yeah. So, very quickly to the next question, many parents have been coming up with this. So I'm just putting it on their behalf that, there has been this vaccine debate, which is not just about COVID-19, but the general vaccine debate, that there are many people who believe there should be no vaccines in the first place. And there are many who believe that, especially for COVID-19, we are so unsure yet, given the speed at which this research has been done. So, will this really be, is this one particularly safe, or herd immunity maybe is a better solution, or maybe I should wait and watch, the other people will get it and then I'll be fine. So what would you suggest?
Well, first let's do a bit of classification there. There are two distinct entities we need to be aware of. One is called the anti-vaxxers. Anti-vaxxers are people who are like the flat earth society. There is a flat earth society who believes that the earth is flat. No matter what you do to convince them, you can take them on a space shuttle and do a tour around the world and come back. As soon as you land, they'll say that we saw a flat earth. No, that's called a flat earth society. That's called delusional thinking. Now, delusional thinking is you cannot be convinced by facts or by logic. Now, anti-vaxxers belong to that category. You cannot convert their line of thinking, but that's thankfully only a minority. And there are famous anti-vaxxers. There's one in the Kennedy family as well. So you've probably seen this post more than my own posts on COVID-19. The second group is called vaccine hesitancy. Now, vaccine hesitancy, they're not bad people. They're regular people, maybe a little too apprehensive, maybe a little bit too much into the WhatsApp university part. So they have so much of information. They subject themselves to information overload without a reasonable amount of background knowledge. Now, what you've seen over the last 1 year is you've seen a lot of pseudo experts come on the social media platforms, and you see them sitting on the cartoon as you see the real expert sitting in a lab and doing this with a test tube, and the pseudo expert sitting on a toilet seat with a WhatsApp with a mobile phone. Now, that's pseudo. So the problem is when we read information without background knowledge, we may be able to reel off some scientific terms. It's like speaking a few words in German without knowing the language. You might get away with a couple of phrases, but you'll make a blunder. So that is what is happening now. So what we can do is, if you really ask, I don't know the solution to this, but we just have to separate the two. We must never fight with them. If you wish, I can come up with, because I'm a chronic hoax buster. I'm one of the biggest hoax busters in this end of the world. So I can come up with some strategies with you. If you have the time, I'll brainstorm some strategies with you. I'll reel off a few strategies I use in India to beat hoaxes. One, never argue with an idiot. All right. So the first is an idiot screen. It's an old saying. If you're faced with a question, you must really understand if the question is coming to you, is that person a heckler, or is that person really curious and learning and changing one's thoughts based on the information given? So if the answer is one, you just walk away from that. Don't waste your time with idiots. Right? So that's number one. Number two, if the person is genuinely interested, these people come in two categories. One is the convenience factor I told you. They're always looking for a convenient answer. See, I'm a gastroenterologist. I only treat gastro diseases, even though I have all these medical degrees. I've focused myself to one area. I get a lot of, Kerala is the capital of alcohol. I get a lot of people come and ask me, doctor, can I drink? Now, if I tell them no, you know what, they'll go to the next doctor and say, doctor, can I drink? That doctor also will say no. A third doctor will say, maybe you can have it. So that's typically the second category that I mentioned. They will come and ask you for information. They're just asking you to reflect their views. So if you don't reflect their views, they'll go away and find a source that will reflect their views, and that'll. The third category is what we must really focus on, who are genuinely concerned. Like, say Dr. Amrita falls into the third category. You're a scientist. You are a woman of science. I can tell you're very logical. when you ask a question, you're asking for your own sake, for your own knowledge. So those people we must engage. And even if they may sound a little rude in the beginning, it can happen. Remember, social media, it has no tone. A word, a phrase can look really hostile, especially if their language comprehension is not very good or the language command is not very good. But I interact a lot on social media. What I do is, even if it sounds borderline rude, I assume it is not rude, and I give them a very matter-of-fact but polite, courteous reply. And 100% of the time, I've had good responses. So those are three categories. So that's a strategy of handling these three categories of people. Anti-vaxxers, don't even go there. Don't go anywhere near them, because you don't want to waste your time. You want to spend your time in doing more productive. Second is the ones who want confirmation bias. That's confirmation bias. I want to drink. I go to a doctor that will tell me I can drink. Yes, those people also don't merit it. And third category, we must identify them and educate them with facts. If you educate them with facts, they will respond better.
Beautiful answer, and you've taught me a lot of new terms. Like, I love that flat earth society. And just to share, we did this literature festival. The theme was living in the age of misinformation, and you have so beautifully pointed out how so much of WhatsApp University and information overload is all around us, and so one of the things that has come out of this is also that a lot of people are talking lots of myths around it, but a lot of people are saying that adolescents in particular should not get the vaccine because hormonal changes they can react and they'll have adverse reactions and they're more likely to have all these. Is there any any logic or any genuine scientific reason to this? Or
okay, as of now, I'll explain what the vaccine does and what the vaccine does not do. We are talking about a COVID vaccine. We are not talking about other vaccines. As far as the COVID vaccines go, the data we have is just 3 months into the date of delivery of the second dose, right? So whatever information is percolating is based on observations over the 2 to 3 month period after vaccine. What we do know is as follows. 1, it stops you from getting a severe COVID-19. Remember, I mentioned there can be asymptomatic patients. Somebody might just have a little bit of blocked nose. Somebody might have a little bit of fever. We're not talking about those. We're talking about the ones who land up in the hospital on a ventilator, require oxygen. Now, if you take a vaccine, you're much less likely to end up in that group. That is pretty much what the vaccine does for you. What the vaccine does not do, again, needs to be highlighted. As of today, that is on the 18th of January, the information we have is that vaccines do not stop you from getting the virus infection, and the vaccines do not stop you from spreading it to your colleague or to other people in your class. So it depends what you're taking the vaccine for. I equate vaccines like a motorcycle rider wearing a helmet. See, if you're riding a motorcycle, if you wear a helmet, it doesn't stop you from having an accident. But if you have an accident, you have a better chance of walking away alive. So that's pretty much how a vaccine works at this point. Vaccine does not stop infection, and vaccine will not cause herd immunity. I'm very sorry to disagree with a very, very large school of thought. Herd immunity applies to immunity in a community to a disease that happens once and you get lifelong immunity. COVID-19 is not a lifelong immunity. It comes from a family of viruses that repeatedly cause infection. So herd immunity will not work here. China is heading for a lockdown now. Sudan is in deep trouble, and UK is locked down. And in Brazil, as of now, in the second largest city in Brazil, as I speak, they're having a rapid surge of cases from a new variant after 75% of their patients of their population were infected even before. In other words, they're going through a second cycle of infection. So which is why I said we are sitting at an unknown point in an unknown timeline. So we just have to, remain very vigilant.
I think it's important, Dr. Amrita, to understand that we're all victims of herd mentality, but certainly not victors of herd immunity, which is a very important point with Dr. Rajiv, man, because this is one of the biggest myths going around.
So, Dr. Rajiv, I have a few very generic questions in general about vaccines.
Yes.
Not questions, in fact, because I am a part of various parent communities and I talk to a lot of parents myself. So, and I hear many people say a lot of things about vaccines. So, yes. I just wanted to clarify a few things. I'm sure, and I think you can best answer these. So, because the first thing I hear is that people say vaccines contain certain unsafe toxins.
No, they don't. That's false.
They don't.
Don't worry.
Okay.
They don't.
All right.
Next.
There is a class of people who keep saying that vaccines cause autism and
they
can
don't.
lead to sudden
They
death.
don't.
Okay.
I'll tell you why. I'm interrupting you because I think that way we can cover a lot more topics. Like a
Sure.
I think
That's
Mr. Sharma said rapid fire round. Put it in one sentence. This is a hoax paper, a fake paper published by a doctor in the Lancet. And it's one of the darkest moments in medical history where a doctor actually published a case based on fake data. And that doctor has since been debarred. That paper has been withdrawn. But the damage he caused has caused this myth about autism that's happening all around the world.
Right.
His name is one of the most, let's say, notorious names in medical history.
There is a class of parents who feel that they don't need to vaccinate their child because other children around them are already immune.
Yeah, that's the herd immunity concept. If we are talking about, say, polio vaccine, yes, that concept actually holds. But we must also wonder why the parent is refusing to vaccinate the child. See, the child is not a small adult. The child is an individual. And the parent temporarily happens to have the custody of the child. But they should not be interfering with the child's right to health. So that's a complex ethical issue. Really speaking, the parent has no right to stop the child from getting the standard of care about health in prevention. If the child develops an infection, let's say measles, for example. See, measles is seen as a mild illness. But if you really look at a large population getting measles, we are talking about a huge number of pneumonia cases, deaths, and some children with lifelong disability. Now, if the parent had refused vaccination and the child ended up in a problem, the parent should be held liable. That is not because the child is so small and powerless and does not have the financial resource or the knowledge to override the parents' unwillingness to give them standard of care. So that is an ethical problem. If somebody is known to do that, I think the state has to step in.
All right.
That's all.
Good, Shyam. All right. So I think it's time. Let me be a little selfish and take the center stage myself with a few questions. If I may, Dr. Rajiv.
Go ahead.
Questions to you. Your answers will be absolutely as sharp and candid as they always are.
Thank you.
Is a vaccinated person required to wear a mask?
Yes. For the same reason, because he or she could still contract the virus and spread the virus.
Will the Indian vaccine be better, equal to, or lesser effective than its global counterparts?
All vaccines that are mainstream are good. I believe that they're equally good, and nearly all of them are 100% effective in stopping severe disease, including Pfizer, Moderna, Sputnik, Sinopharm, Sinovac, and AstraZeneca.
It's a completely democratic vaccine, right?
Right. Yeah. The new vaccine, the Covaxin, that is the Bharat Biotech vaccine, we just don't have the efficacy data. But it's, you know what? It is identical to the Chinese vaccine. It's identical or even better constructed than the Chinese vaccine. So I would theoretically expect a better efficacy than the Chinese vaccines.
Anybody who has had COVID-19 and recovered does not need to get vaccinated.
That's a good question. It's my belief they don't need to be vaccinated because if you are naturally infected, there is evidence, as I think Mr. Sharma has my tweet on that, there is firm evidence that you have a 90% protection over a period of 6 months. That's probably the best quality evidence there is from the UK trial of over around 11,000 people, whom they followed diligently with testing over a period of 6 months. It's physically impossible to do such a test in any other part of the world. So hats off to the British for doing that and giving us the data. So if you have a 90% protection after natural infection, why would you get vaccinated? But I must admit the government of India and governments all around the world have advocated that people who've recovered once from COVID-19 should also be vaccinated. And the logic they follow is that if you get vaccinated, you get a standardized level or a predictable level of antibodies after the vaccination. That being said, it leads us to uncertain territory that an antibody level is not a guarantee against infection from COVID-19, unlike the case of hepatitis B. So for hepatitis B, very briefly, if I take a shot of hepatitis B and I measure my antibodies, if the level is good, I will never get it. But that's not true for COVID-19.
Long-term side effects of the vaccine may be severe.
I think the answer is exactly the same word as your question. Long-term side effects may be severe. We simply do not know, because long-term will only be known in the long term. But comparable vaccines have been used in the past. For example, the Bharat Biotech vaccine has been a traditional platform vaccine. Inactivate an agent, you beat up a bug so badly it can't even walk. You put the bug into a person, and the person does not get infected. They make antibodies against it. What harm can happen? Literally no harm can happen. I must also make a point here that about the vast majority of so-called treatments we use in India, encompassing all forms of treatment, are not evidence-based. None of them have been put through randomized trials. None of them have been put through animal trials, but we take them all with a great deal of confidence. Why? But when a vaccine comes with published data, people are standing up and questioning it. So I see a bit of a double standard there. I'm not talking about you, but I'm talking about society.
Underlying health conditions like, let's say, diabetes, maybe an underlying heart condition, even maybe malignancy, this can actually render the vaccine ineffective.
No. In fact, people with these conditions should preferably take the vaccine. They should also be in the preferred list, on a high priority list, because theoretically their risk of developing a severe disease with the same virus is small. Excuse me. Excuse me. So in other words, if you to put it in mathematical terms, if you take a 20-year-old, a 50-year-old, and an 80-year-old, if you only have one dose of vaccine, I would give it to the 80-year-old, because the amount of prevention of death happening is in the latter case. I just give you a theoretical example to emphasize my point.
All right. Its impact on fertility?
None. I'll also explain why that hoax came about. These hoaxes come about. There are two prominent hoaxes. One is in the American circles, because Americans are big time into anti-abortion and they're very sensitive about abortion. So there's a myth that's going around that this vaccine contains the dead cells or the cells or the tissue of an aborted female fetus. They added the female part just to add the emotional angle to it. That's not true, because all these vaccines are derived from viruses grown in tissue culture. Tissue culture is made from either organs or cancer cells or from aborted fetuses, because we need cells they're basically cell farms. They're not organs. So that is the link to the abortion part. I'm putting the abortion part in connection with this topic. And the point you mentioned is about fertility. It's the most ridiculous thing I can think of. Again, the WhatsApp University, because the spike protein, if you look at the spike protein of the virus, it has a genetic code. And in the genetic code basically is a list of alphabets, which is 29,903 long in this virus. And among them, a few alphabets in the spike protein seem to correspond to what is called the syncytin gene that corresponds to the placenta. Now, if that's the case, then even getting COVID-19 could make you infertile. But people who got COVID-19 are not infertile. So logically, you can tell them, look, if that was true, if the vaccine would make you infertile, getting COVID-19 could also make you infertile, because it's the same spike protein. So the answer is no.
All right. And the final question, which actually brought a smile on my face, which came to me a short while ago, was it's said, it's presumed or speculated at best that it could actually alter your DNA.
It won't. The reason is that the vaccine does not really enter your nucleus and does not get integrated with your nucleus. The mRNA vaccine, for example, is almost like an email or a WhatsApp message that self-destructs. The message disappears as soon as your ribosome reaches it. Ribosome is the unit in your cell that actually manufactures proteins. So it's like a message that goes into a factory. So that is the mRNA code. And the same thing with the AstraZeneca vaccine. And as far as the inactivated virus vaccine or the Bharat Biotech or the Chinese vaccine, it has nothing to do with DNA at all. They're just picking up rubble from a virus and trying to manufacture antibodies against it. So all of the above are false.
I think that's just about it. There are a lot of questions doing the rounds, but I think we've covered most of them. And of course, you've answered them most articulately. We've 20 minutes over time on the show. It just tells you how absorbing our discussion was. I started out by saying, if there's one voice which is candid, which is compassionate, yet most importantly credible. It's the voice of Dr. Rajeev Jayavadevan on the vaccine. And I thank you for confirming that over these last 45 minutes. Dr. Rajeev, it's been a pleasure having you on the show. It's a pleasure having you, Dr. Amrita, with your questions. Thanks for joining us, Shaun, on this show. You know, I think the biggest representation of this program, my biggest takeaway, encapsulated by that one statement you made, Dr. Rajeev, was that getting the vaccine is like a motorbike rider who has actually just worn a helmet. It doesn't prevent you from having the accident. It just puts you in a better position to prevent the impact of that accident. So thank you for highlighting that, and that encapsulates everything.